When the COVID-19 health crisis gripped central Indiana, Director of the Marion County Public Health Department, Dr. Virginia Caine, was equipped for battle. An infectious disease doctor by training, she's no stranger to outbreaks. Ebola, H1N1, measles on college campuses, TB outbreaks, her career has covered it all. But COVID-19 has no doubt had unique challenges. Dr. Caine joins me now to tell us how she's tackled the toughest year yet. Dr. Caine, thanks for being on the show today.
Well, thanks for having me here.
I know this last year has been a lot of tough decision making. You've talked about how it's been a balancing act. Just give us a glimpse into the last year, what it's been like to have to make some really tough calls.
So, collaboration. Oh, sorry.
That's okay. Go ahead.
Do you hear that?
Yeah, we can hear you good.
Okay, sorry. So collaboration has just been tremendous. And we've just had so many voices that have helped us to make better decisions. We've had to sometimes, like even in the middle of the night, have to make some major decisions under a lot of pressure, which can have a major impact on a community. And so how do you do that? And what you find out is because of the many voices that you're able to collaborate with, hear the different perspectives. For example, we've worked quite frequently with our Chamber of Commerce from a business standpoint. You're balancing these short and long-term needs of economy versus public health needs of an entire community. And those are not always easy to do. But when you can have scientific experts help you with this perspective, looking at things from a business associate perspective, even the clergy, with the faith base, have helped to make these better decisions and sometimes tough decisions.
Yeah, and you mentioned off camera, the science is moving so fast that it was hard to make some of those decisions with the science changing so quickly. Of course, now vaccination is center stage. What are the challenges as you're leading the charge here in Indiana to get the largest city in the state vaccinated?
I think the number one challenge for us is just having adequate amount of vaccines to distribute to the community. And because we don't have adequate vaccine, we're having to make the tough choices about who should get the vaccine first. Our second challenge is, of course, is how do we, from a health equity standpoint, be able to do an equitable distribution of the vaccine in some of our hardest to reach populations who may not have access to internet or a computer, and they have to do it by phone, but sometimes by the time they're ready to do it by phone, all the appointments are filled. And so we have to work with our faith-based institutions, our civic organizations, our neighborhood associations, and those trusted community leaders in those areas to help us get the vaccination to the people that's really needed, as well as our teachers, our frontline people like our Indy bus drivers, our air traffic controllers, just tough challenges.
Yeah, you said you love your plan that you have for vaccines, but it's hard with supply.
It's very difficult with supplies. And there's so many deserving people who need to get this vaccine. But we've primarily worked with a risk stratification standpoint, trying to keep the people from hospitalizations, from being in the intensive care units and dying.
Right.
But it's a tough challenge based on the availability of vaccine.
Okay, we have to talk about March Madness, just days away from tip-off. You believe this is a good thing for Indianapolis and that the city is ready to host it safely. Can you talk about that a little bit?
Yes, you know what? We've seen something tremendous here. We've seen the city of Indianapolis and even the state of Indiana come together. So we are just so glad to welcome people back to our downtown area. And let me just say, it brings a sense of optimism to everyone in this community. But hey, I'm not surprised about this because we've had a track record of coming together. And even though the stakes were really high, we have met the challenge. And so we're showing cities across the country how to get back to business.
All right. Well, like we said, tip-off just days away. Again, another balancing act decision. Dr. Caine, thanks for being on the show today.
Well, thanks for having me. You're a very popular show, and I love watching you guys all the time.
Well, thank you. We
Thanks for
appreciate
having
that.